Many things can go wrong when we have urinary dysfunction. One of these is called metabolic acidosis. See the word acid in that? Well, that involves the kidneys because their job is to release bicarbonates into the bloodstream to maintain a proper blood pH. But in acidosis, well, the kidneys just aren't doing their job. The blood is going to become acidic, meaning the pH is going to drop. Initially, there are a few signs like headache, shortness of breath, diarrhea, but in later stages, nerve cells may fail to function, and that may result in convulsions or even fatal comas. Something to pay attention to. Often caused by severe dehydration, overuse of antacids, kidney dysfunction, but many other diseases also tie into this disorder. Chlamydia is out there. It's out there waiting for you if you make a mistake and don't pick your partners carefully. It's a bacteria that enters through moist membranes of the mouth, anus, or vagina. Early, the lesions they're painless sores, but later the bacteria is going to travel in lymph nodes and they become swollen and very tender to palpation. So this is a symptom of a later stage of chlamydia. Eventually travels up the uterine tubes, causes sterility and other problems. About 80% of the infected women lack obvious symptoms. And here they go passing on this bacterium to others. 40% of men lack obvious symptoms. Gonorrhea, here's a famous STD, sexually transmitted disease. There are many strains that are resistant to antibiotics. So at one time we thought we had gonorrhea under control, but no longer. It's mutating. In women, the cervix is the prime organ affected. From there, the bacteria can spread throughout the reproductive system and other tissues of the body in both men and women. In men, one of the early symptoms is pus in the urine. And women may not have any symptoms until later stages when the bacteria has spread into the oviducts and other parts of the urinary and reproductive system. Syphilis, another STD. It will also infect moist membranes of the human body, not just the genitals, but areas of the mouth and anus. And here, bacteria may spread and form lesions in the skin, and we call these cankers. That's the classic early symptom of syphilis. These are sores that are packed with active bacteria. A person's highly contagious, so if you have a patient coming in with open sores like this, you want to glove up and even mask up to protect yourself. Secondary stages involve invasion of the bacteria into eyes, bones, and nervous system. And there is a tertiary or third stage, which is extremely serious. Finally, something that's not an STD and not serious, although can be very painful. Kidney stones formed from deposits of uric acid, calcium salts, other substances that are going to crystallize in the renal pelvis. And that's the area of the kidney that empties into their urethra. Some people are prone to getting kidney stones, and so their diet is important. High levels of calcium in the bloodstream are going to increase their risk. But other people can have high calcium levels and not form stones. Lithotripsy is a procedure that it's going to use high energy or ultrasonic waves to break these stones into fragments. And we can pass them out through the urethra in our urine. There's also a basket that's driven up the urethra. That sounds too painful for me to want. You always know when a patient has kidney stones, or at least you can suspect it if they're in the emergency department and they're walking up and down. They can't seem to sit still. They're hunched over and a lot of pain, and they have no pre-existing symptoms of anything. It just hit them, sudden onset, and you want to think, uh-oh, kidney stones. Glomerular nephritis another kidney disease, and this can be caused by infections, hypertension, diabetes, or sometimes our own immune system attacks self-tissues. Whatever the cause, the result is often a poor or obstructed flow of fluids to the glomerulus. And if you have forgotten, the glomerulus is that marvelous clump of blood vessels in the Bowman's capsule where fluids are pushed through into the kidneys, and then the large substances travel outwards. Damage to the glomeruli, that's plural for glomerulus, causes the blood and protein to be lost in the urine. And furthermore, when proteins are broken down, there's a nitrogen group that can become ammonia, can become toxic, and so that also becomes concentrated in the blood. One of the options for this and other kidney diseases that affect the functioning of the nephrons is called hemodialysis. And look at that word, hemo. You think of blood right off. In this case, a dialysis machine is connected to a blood vessel, and then the blood is pumped through tubules. And these are going to contain a precise mix of glucose, salts, and other substances. They're trying to simulate what happens in the proximal tubule of the nephron. And remember the loop of Henle and all that goes on. Now, some people can just go once a week or 3 times a week. Others cannot go far from the machine. The result is clean blood is returned to the bloodstream. Nephritis, look at the suffix itis. You know there's inflammation going on. In this case, it can be caused by bacteria, viruses, or sometimes just a blow to the kidneys, some sort of injury. The problem here is the kidneys are encased in a tough protective tissue called the renal capsule. It's that outer layer, and it does a wonderful job of protecting it, but the problem is now there's nowhere for the pressure. The pressure is going to go inwards, and as the pressure builds up, the nephrons can no longer function properly in the filtering of blood, and sometimes kidney failure is going to result. Pain is one of the early symptoms of this. Tenderness as well. Renal cell carcinoma is one type of kidney cancer. It's one of the most common. It begins, as most cancers do, as a mutation of normal cells, and they're going to divide rapidly, and they're going to form tumors that go through angiogenesis, in that they're going to create their own blood vessels. Okay, they're very wise. As the tumor grows, the cells inside are going to become starved of blood, so why not make your own blood vessels? Cancer cells are then going to metastasize, which means to spread into all parts of the body, because kidneys are connected with the bloodstream directly. That's their job, is to filter blood. Why do people get renal cell carcinoma? Well, certainly smoking and exposure to some harsh chemicals, especially in industrial settings, increase your risk, but many of the kidney cancers, the cause is just unknown. UTIs, urinary tract infections, these are, it's an inflammation of the urinary bladder. If you recall, the kidneys are going to dump into ureters, which dump into the bladder, and finally the urethra. So why do we get these? Well, chlamydia, syphilis, and even a person's own fecal bacteria, especially in the case of women. That's why we teach our daughters very early in life to wipe from front to back, so that fecal bacteria do not enter the urethra. And that's why women are at greatest risk, because the urethra is very short, about 2 centimeters long. A man's is more like 20 centimeters. The symptoms are variable. There are many, but pain when urinating, cloudy or foul-smelling urine, frequent urge to urinate, but there are many others, back aches and fever and so forth. So this is something that you want to pay attention to, because there's a direct line from the bladder to the ureter to the kidneys. Polycystic kidney disease. Cysts are just semi-solid masses. They may not be cancerous. They form on the kidney, and gradually, over a period of years, they may reduce kidney function. And this is generally inherited. It's an autosomal genetic disease, so not infectious. Symptoms may include frequent UTIs and other, well, of course, kidney dysfunction in time. Treatment, of course, dialysis can help these people, but a kidney replacement is a good long-term solution for people with PKD. And many people learn to manage this disease, especially if it's slowly progressing, such as this amazing girl who is a national karate champion and also is suffering from polycystic kidney disease.
Cystocele is a hernia-like disorder, which means there's tissue in places where they don't belong. In this case, the wall between the bladder and the vagina are going to weaken, and this allows the bladder to drop into the vagina. Sometimes it's called dropped bladder syndrome. There's some discomfort, and the bladder may stretch the opening of the urethra, and so a woman's going to suffer from urinary incontinence, which is leakage of urine during certain activities that apply pressure to the bladder, such as coughing, but there's running, sneezing, lots of things. Benign hyperplasia is a condition that affects only men because we have the prostate gland. If you look at the diagram, you'll see that it's sort of straddles the urethra. As a man ages, that prostate is hammered by testosterone, and it's going to swell. It's a natural process. And over time, it becomes difficult to urinate. And there's some discomfort because the urine is sometimes never completely expelled, which is a good reason, another good reason to sit when a man urinates so that he has a better chance of expelling the urine. Problem with BPH is sometimes we think it's BPH, but it's really cancer. And the man's not tested until late in the game. Urinary incontinence is leakage of urine, and it's caused by many factors, but disease, heavy use of certain medications, and the onset of a urinary tract infection is often heralded by a UI. There are different types of incontinence. I'm giving you two. One is just urge incontinence, and we see this in senior centers and in hospitals. The patient just can't make it to the bathroom in time. The urge strikes too late. There's diabetes going on, stroke, dementia, Parkinson's, various things. And these individuals end up wearing a sort of a diaper that is fine. One day we're all going to be there if we live long enough. Stress incontinence, as the name suggests, is leakage due to any kind of stress on that bladder. It could be exercise, coughing, sneezing, laughing, lifting, anything that applies pressure. So these individuals often wear a little Kotex when they run or when they do certain activities, and that takes care of the problem in most cases. A kidney failure can be serious, or it can be relatively mild. Acute failure, it has an abrupt onset, which means it happens quickly, and usually it's reversible if the conditions are controlled. So someone has a heart attack, severe infection, dehydration, any sort of sudden onset disorder that restricts blood flow to the kidneys can result in acute kidney failure. Chronic tends to be sort of silent, low grade, and often the individuals don't even know that their kidneys are gradually being destroyed. It takes well over 3 months. It takes years often. A cystitis, so a chronic urinary tract infection. If a person doesn't manage their diabetes well, which is going to influence blood flow. And hypertension, blasting those nephrons in the kidneys over time, they'll be destroyed. Permanent renal failure is a very serious condition. Big summary here. I'm going to just hit the highlights. Metabolic acidosis. That's when our bicarbonates in the bloodstream are attempting to buffer some of the acids. But if the condition becomes serious, we have convulsions and coma. Chlamydia is a condition where 80% of the women and 40% of the men lack symptoms. So it can be spread quite quickly. It moves from the urinary system to the lymphatic system. Gonorrhea, a STI. There's a lot of resistance, drug resistance, and so this one is on the move again. We thought we had it under control. Pus in the urine can move into the oviducts. Syphilis, another STI. We're going to have cankers, which is one of the hallmarks of this disease. And a secondary infection is going to move into deeper tissues in the eye, the bone, nervous system. Kidney stones, very painful, although not as serious as some of these other disorders. We're going to have uric acid and calcium crystals causing a very painful acute condition. Glomerulonephritis, which is a mouthful. Obstructed, well, there's lots of things that are going to cause this, because you see the word itis, inflammation. Hypertension, certainly pressure in those fragile nephrons. They just can't handle it. Or restricted blood flow from conditions such as diabetes. Nephritis, there's that itis again. Inflammation, here the problem is the capsule, which protects the kidneys, becomes a problem because it doesn't allow for the expansion of the internal environment, as we have in edema and swelling of the internal portion of the kidney. Cancer, it becomes a problem when we have metastasis, and that means the tumor has broken free and is on the move. UTI, or cystitis, is an inflammation that can have many causes, but we often painful urination, cloudy urine, fairly easy to treat in many cases. Polycystic kidney disease is inherited, okay? It's something that you were born with. There may be many cysts or just a few cysts, and it can contribute to lots of disorders of the urinary tract. Cystocele, or cystocele, it's pronounced, is a condition where the bladder has dropped because the wall has weakened, and it's going to apply pressure to the urethra and sometimes resulting in leakage. Benign hyperplasia affects men only because of the prostate. That prostate is swelling, pinching off the urethra. A UI is incontinence, and there's various reasons for it. There's urge, and that's where the person just can't make it to the bathroom in time. And there's stress related, where there's pressure on the urinary bladder due to exercise or movement generally. Finally, renal failure. It can be acute due to something sudden, such as a heart attack, or it can be chronic due to a long-term infection, something like uncontrolled diabetes or hypertension.